So we can avoid some findings of asking what is the complications so that they have it. And another thing is another medication. So what are the medication that has been previously taken by the patient? So that is also we have to ask. So because so many of the patients that has been affected by the cardiovascular disease, hypertension, diabetes, is the most prevalent one. So patients are taking some other medication also. So then what are the conditions? So they have that certificate for. So then for that drug, so we can already what they are having and what we have to give. So then so that we can have a idea about what are the medications now we have to give. So then so we have to know about what are the medications so they are having already. And next one is a pregnancy and the breastfeeding. So then pregnancy and the breastfeeding. So for them, there's a special category of there's a medication is there. So they are considered as there's a special category. So then the dose maybe so changed, and then so what is the expiration of the drugs. So then that and all has to be considered for a pregnancy and the breastfeeding. And the size of the patient. So then so we have to give attention to the single patient at a time. So then so we can reduce the medication errors. So then so what are the strategies for unsafe medication management present? Implementing the standard prescribing practices. So then so every hospital they might have an that's a hospital formulary system and every hospital that we have an so pharmacy and therapeutics committee. Students.
Those who are not interested can go to the last one, sleep in the class at least. Don't take that if you are not interested. Please try to learn yourself. Want to learn? Learn. Otherwise, don't see. Take rest. Don't spoil your talent. It is just
So thank you for your cooperation. And so what about so implementing the standard prescribing practices? So when so that the hospital that they have their own guidelines according to the guidelines, the prescribers, and then according to the hospital formulary and what are the advice that has been given by the pharmacy and the therapeutics committee. So that physicians have to implement their prescribing practices. And then so use of electronic health record. So nowadays the electronic health record that has been available. So every information has been so feeded in the so system. So whenever you go, so by means of one number, so we can get the so all the information about the so patient. So nowadays the has been available. And then double check the systems for high risk medication. So high risk medication. So that is in case of there's emergency medications or essential medicines list that has been so available. For that, so we have to do the double checking. So before that's prescribing the medication. And then continuous education and training of an healthcare staff. So that is up-to-date knowledge about what are the drugs that has been. So currently it has been so that has been so distributed now or it has been so approved now. So that drugs so we know that. So then so that is updating knowledge. So for all the healthcare professionals is very important. So then so this is about that's a WHO that has been so standardized for. So what are the so that's what has to do. So with the healthcare professionals, that's a healthcare professionals, that's a doctors. So they have to improve their knowledge about the drugs and then so improve about the so documentation and the reporting about the area. So that is very important for the so healthcare professional side. And then about the medicine side, so what's the important for the that's a procurement. So already we said that that's a procurement and storage and dispensing, prescribing. So everything is important. So for that, what is the need of the cell? That's a labeling. So that's a right product. So we have to purchase the right correct dose and everything. So it's a different types of there's a dose that has been available. So while prescribing, what is the dose for the that person? So what's the age of the patient? What is the weight of the patient? So what is the complications for the patient? So then without only they have to write the prescription. So then and then storage. So what condition that the medication has to be stored. So then that is also very important. And then labeling. So labeling. So when giving to the that's a patient. So by the patient counseling. So when to take what to take and what are the that's a food they have to take. So what are the non-pharmacological therapies are there? So then so that medication. What about the medication? So why they are taking the medication? So everything has to be conveyed to the patient. So by the pharmacist. And so what are the 5 moments of patient medication? So starting the medication, the patients are going to hospitals, so they are taking the medications. They are the patients, so they may write the medications, and so the patient is taking the medication. And the next one is adding the medication. So why I have so already the drug that has been so prescribed. So then in case of any medicine added that has all otherwise it has been so deleted. So why I have to take this medication? Is that necessary for taking that medication? So then so that question you have to give us what is the question? Why it has been so written? So that as a pharmacist we know that. So but other that's a patients they may not know that. So but in case if they are adding that medication, why? Okay, so we have to put a so question why. So is that it is needed? Is need is there or not? Without working they have to write the prescription. And then reviewing my medication. So that is already we said that that's a documentation is very important. That's a medication short review. So in the hospital, so they are doing the medication short review. So every time or every day, every time. So they have to check what are the medication that has been so given, what is the route that has been so given, what is the frequency that has been so given. So everything, so that has to be so checked or reviewed by the healthcare professionals. So particularly that's the nurses. So in case if you have the consequences that may occur, the patient should not take the unwanted medication. So this points are all that's very important in case of documenting this cases. And then stopping by medication. So when to stop the medication? So in case if any allergic reaction that has been occur, or in case of that's a area that has been so present in the cell, so you have to report to the that's like for the physician or to the nurses or to the pharmacist, so they have to inform them. So then, so immediately, so why that the allergic the or there's a sensitization that may occur. So then what is the drug? What is the cause? So they have to analyze. And then so in case that particular drug that has been so causing in the cell, so we have to stop the medication. So okay, so those are the importance of medication safety. And then so what are the role of healthcare professionals? So then so as a patient, so that's accurate diagnosis. So then that's a patients are coming to the clinic. So then according to the signs and symptoms and then with the laboratory parameters. So in case of that's an inpatient they are admitting in a hospital sense with the what is the laboratory parameters. So with that they have to analyze and diagnosis the correct that's a prognosis of what is the if the right diagnosis with the all the sense they will give the correct treatment. So okay, so that's a main development, that's a vision, and then so we can get a racial drug therapy. And so the nurses are done. So after prescribing the medication, the nurses will give the so that's administration. So in the inpatient hospital, so then that's administration. So administration of a drug. So that is very important. That's a correct duration, correct frequency. So everything whether it has been so right or not. So that has to so check it. And then patient monitoring. So everything that's a patient monitoring. So in case if any allergies are there, if any that's a change that has been supposed in the vital, so that has to be monitored and then entered, documented. And then pharmacist, that's a review dispensing that's a prescription or otherwise during their ward rounds, that's a clinical form, that's a role of a clinical pharmacist. So during the ward round, so what they have to do in the sense, so they have to check about the whether there's a drug interaction that has been so present or the area that has been so present or contraindication that has been so present. So everything should be monitored so by the pharmacist. And then another one important thing is that's a patient counseling. So the patient counseling that has been given by the pharmacist. And the administrator side, so that's ensuring policies and the resources. So for not only, so they are doing the budgeting and that's a hospital formulary system and the PDC committee system. So by this, they are framing the policies. So what are the drugs that we can produce and what are the storage and what are the drugs that we can include or deletions. So that has been so given by the suggestions of the PDC committee. So and monitoring and evaluation. So already we said that that's a review. That's a short and that's a while doing the model. So we have to so check what are the drug that has been so given. So whether that's a drug interaction that has been so present or contraindication that has been so present, whether the dose is right. So everything so we have to check out. So during the medication short review. And then auditing the medication incidents, if any incident that has been so happen or area that has been so reported in the sense, so there is a suspected area reporting form. So one of the forms so by our government, there is a suspected area reporting form. So in that they have to report to the pharmacovigilance center. and the patient education and empowerment, encourage the patient participation in care. So then, so if that's as a healthcare professionals, so we are giving us a patient counseling and everything that's a review, everything so we are doing. So but the patient side also they have to cooperate with the physician. So they don't give their medication taking and the aspects will improve. So then the patients also show their so enthusiasm in the patient care or hospital care. And then educate on the correct use, storage and the adherence. So while so during the discharge of the from the hospital, so what are the storage? There's a medication. So some things that's a medication that has to be stored in a so cool condition or it's a dark condition. So then so what are the conditions that drugs that has to be so stored? So that information so we should give so on the patient counseling. And then so that's provide clear instructions so that it will be said that so and then that's information that should be given. So verbal language or a non-verbal language or a written language. So but what is the important one is that the patient has to understand what you are saying about the regarding the disease as well as the so that the patient has to understand that one. And then so use the teach back method to confirm the understanding. And again, so once again, so we have to ask the questions to the so patients regarding so whether they can understand. So whatever that's a counseling that is given to the patient is right or wrong. So then, so once again, so if the patient doesn't so know about the so what's the counseling they have given. So once again, you have to teach the patients regarding the so medications. So this is the improvement for the patients. So for the conclusion, that's a continuous monitoring, so continuous reporting, and then continuous that's updating their knowledge. So that is very, very important for the medicines management. Thank you so much. Any questions? Any questions?
See, pharmacists, we all are going to be pharmacists in complete our courses. Okay? So, therefore, you learn whatever madam has taken the classes of medication adherence. Okay? Medication errors. Do you have any questions, anybody? Madam will answer. Any questions? Madam, I'd like to add up to your this one. As per the new legal procedures, okay, Indian Penal Code is replaced by Bharat, that is called as Bharat Nyaya Sanchay. Okay, the pharmacist who does the errors, okay, who does the medication errors, is prosecuted. He can be prosecuted now. Okay, there are section 106 of BNS. Okay, then for medical negligence causing the death. Section 124 replaces IPC, deals with causing hurting the patient, or giving false information to the patient, or half knowledge. Half knowledge means the people who don't study properly, with half knowledge, you try to educate the patient. If anything happens, you will be prosecuted under section that is 124. Okay.